Leader of the opposition Joseph Harmon called via a press conference on Thursday for the immediate suspension of 200,000 doses of exorbitant-priced Sputnik vaccines. He questioned the authenticity of the jabs, alleging that the PPC government may have sourced counterfeit versions of COVID-19 vaccines, thus putting the population at risk. Lashing back at Harmon, the health minister said that his stance is, I quote, reckless and irresponsible, end of quote, given that there is no evidence to support his claims, nor is he a medical professional. He called the APNU AFC camp to be responsible and to encourage Guyanese to take the shots to counter the virus and emerging variants. The vaccination program, Anthony reminded, is the only known way to halt the unrelenting assault of the pandemic.
Instead of Mr. Harmon pronouncing on the quality of vaccines, which he knows nothing about, he should be able to go out there and encourage people to take their vaccines. Unfortunately, he's not doing that. And by not doing that, he's putting people in harm's way.
To date, 46.2% of the population, some 224,853 persons, have taken their first jab. 94,243 persons are fully vaccinated against the COVID enemy. That number represents 19.4% of the adult population. Reporting for the HGP Nightly News, Amel Griffith. The vaccines were bought at a cost of just under $20 or 5,000 Guyana dollars per dose, while the price was estimated to be $10 per dose. In a rare admission, government acknowledged that a surplus of monies were spent to source Russia's Sputnik vaccines for Guyanese.
We have not had this price as a secret price. This was known. We have said this many times before. The president spoke about it.
Blaming scarcity and inequity of the vaccines, Minister of Health Frank Anthony, at a press conference on Thursday afternoon, said that this tied the hands of the PPC and limited their access to affordable jabs. And as they continued the trek to attain herd immunity, a decision was made to purchase the vaccines from a middleman or supplier located in the United Arab Emirates, Anthony said. He made it clear that government was happy and is willing to spend money to save lives.
Compare if somebody gets sick and they come into the hospital, what it would cost for us to keep that person in the hospital and take care of them. The medicines that we are using, some of them cost almost $100 per vial. In other instances, if you're in the ICU, you would require at least 15 liters of oxygen per minute, and that's a lot of cost.
Minister Anthony said that despite COVAX's promise to supply vaccines to inoculate 20% of the local population, this has not materialized. To date, Guyana has secured approximately 300,000 jabs with help from bilateral partners like China, India, and Barbados. The minister said that efforts were made to purchase the vaccines directly from the manufacturing giants themselves, but were told that the companies had larger contracts with high-income nations and could not provide the jabs in 2021. And responding to questions by Harmon relating to the Food and Drug Department's capacity to effectively approve the vaccine use locally, Minister Anthony explained that the findings and data from international regulatory bodies shaped approval.